Welcome back to Employers Are Asking. Today's topic is vaccination administration costs. My name is Brooke Salazar. I am the Associate General Counsel here at Apex Benefits as well as an HR consultant. We do need to remember that this is only guidance and should not be considered legal advice or counsel. Let's get into it. So we know that the CARES Act provides that all insurance plans that are subject to the ACA's preventative services coverage standards must cover any qualifying COVID preventative services, which includes approved vaccines. And that's without cost sharing to the employee. And we know that that vaccine is covered by, the vaccine cost is covered by the government. However, we're starting to see administration fees, which is allowed. So effective for COVID-19 vaccines administered on or after 3/15 of 21 for federally ran vaccination sites, immunizers, physicians, hospitals, pharmacies will be able to charge a $40 administration fee for each dose of a COVID vaccine, which is an increase from 28 to 40 and an increase from 45 to 80 for those vaccines that require 2 doses. The exact payment rate for the administration of each dose of a COVID-19 vaccine will depend on the type of entity that furnishes the service and will be geographically adjusted based on where the service is furnished. We saw that CMS was allowed to adjust their administrative fee cost, and now what we're seeing is private administrators are also adjusting. So it's not just the Medicaid or Medicare. We're seeing that private entities that are doing the administration of these vaccines are now also going to adjust to align with those CMS coverage costs. So what plans are allowed to share costs with participants? And we know that this is not going to be very many plans. However, I thought I would just run through it really quickly. If the plan is not subject to the ACA's preventative services coverage standards, it's not subject to the CARES Act and the vaccine coverage requirement. So these could be short-term health plans, fixed indemnity plans, grandfathered plans, etc. Individual states may ultimately require plans to cover the vaccine and waive cost sharing, so make sure you check if you're not going to cover vaccines because you don't feel that you're an ACA covered plan, you do want to check with those individual state laws. However, the cost of a vaccine may be cheaper, which we know is a lot cheaper than inpatient COVID care and COVID long hauler therapies that are necessary after the inpatient care. For the complete administration of the Pfizer and the Moderna vaccine, it could cost between $45 to $80. And then at federally run sites. And for state run sites, we're seeing about a $28 administration fee for the first dose and a smaller fee for the second dose. So what are our next steps? How are we tracking this here at Apex Benefits? Our Kinetic Health team will be monitoring vaccination administration costs that flow through our health analytic platforms, and we're also working very closely with our partners to continue to monitor what those administration costs are and what impact they may be to the plans. And again, we just want to reiterate the $45 to $80 per dose. And if you're looking for further resources, the Indiana Department of Health is a great one. The National Council for Prescription Drug Programs, CMS, they all have pricing according to billing codes out there. I hope this has answered some of your questions about vaccination administration costs, and have a great day.